clear. It's a healthcare question for you, and I'm really focusing on price tags here. Governor Richardson, for example, says that you can fund healthcare meaningfully without raising taxes. Senator Clinton has said that she's not prepared to say she will raise taxes to reform healthcare. Your plan does raise some taxes to fund your universal healthcare program, so I'm wondering, from your perspective, are they being honest about the true cost of universal healthcare in America?
Well, let me say first, I think it's a very healthy thing that we have Democrats coming out with health care plans. This country's health care system is completely dysfunctional. I'm proud of the fact that I was the first person to come out with a specific, truly universal health care plan. Senator Obama came out with a plan just a few days ago, which I don't believe is completely universal, but he deserves to be credited because he laid out what the cost is and exactly how he was going to pay for it. And I do believe that, and by the way, you didn't say this, but my plan costs $90 to $120 billion a year. I pay for it by getting rid of Bush's tax cuts for people who make over $200,000 a year. And I believe you cannot cover everybody in America, create a more efficient health care system, cover the cracks, you know, getting rid of things like pre-existing conditions and making sure that mental health is treated the same as physical health. I don't think you can do all those things for nothing. That's not the truth. And I think people have been so sick of listening to politicians who come and say, we're going to give you universal health care, we're going to change the way we use energy in America, we're going to strengthen the middle class, have middle class tax cuts, and in the process, we're going to eliminate the federal deficit.
Thank you.
That is not the truth.
Thank you,
and
Senator.
we need to be honest with people about that.
Let me let Senator Obama weigh in, because you did release your plan that Senator Edwards says is not really a universal health care plan because it isn't mandatory on everyone. I wonder if you'd want to respond to that.
You just identified the basic disagreement with John. And by the way, I think John has a lot of good elements in his plan. And I think that as people release their plans, I think there's going to be a lot of overlap, which is a good thing. But the main disagreement with John and I is John believes that we have to have mandatory insurance for everyone in order to have universal health care. My belief is that most families want health care, but they can't afford it. And so my emphasis is on driving down the costs, taking on the insurance companies, making sure that they are limited in the ability to extract profits and deny coverage. That we make sure that drug companies have to do what's right by their patients instead of simply hoarding their profits. If we do those things, then I believe that we can drive down the costs for families. In fact, we've got very conservative, credible estimates that say we can save families that do have health insurance about $1,000 a year, and we can also make sure that we provide coverage for everybody else. And we do provide mandatory health care for children.
Senator Clinton, you've been involved in this issue, as all of us remember, for a long time. What do you think of Senator Obama's plan?
Well, I'm thrilled that universal health care is back on the national agenda. You know, as we remember back in '93 and '94, we tried to come forward with the plan. We weren't successful. I have the scars to show for that experience. But I am convinced that now when the Democrats all are coming forward saying this has to be a national goal, we then can try to get the political will. The most important thing is not the plan, because there are only a few ways to do this, and we're all talking pretty much about the same things. From my perspective, we have to lower cost, improve quality, and cover everybody. What's important, and what I learned in the previous effort, is you've got to have the political will, a broad coalition of business and labor, doctors, nurses, hospitals, everybody standing firm when the inevitable attacks come from the insurance companies and the pharmaceutical companies that don't want to change the system because they make so much money out of it.
Senator Clinton, you can do that without raising taxes?
Well, here's the challenge. I have put forth approximately $120 billion in savings from healthcare changes that can come, everything from electronic medical records to better management of chronic care. That is about in the ballpark of what all of us believe it will cost to cover everyone. The challenge that I'm wrestling with is how do we realize the savings? Now, I don't think there's any Democrat that is not going to let the Bush tax cuts on the wealthiest Americans expire. We're all going to do that, so that money will be available. How then do we set forth the priorities that we want to address, including energy efficiency, dealing with global climate change, and so much else?
Governor Richardson, I want you to weigh in, and then I'll let Senator Dodd weigh in.
As governor of New Mexico, this is what we did. We insured every child under 5. My wife, Barbara, who sits here, led an effort in the state to increase immunizations. We got rid of junk food in schools. We brought mandatory
But can you
phys ed
do
in.
national health care,
Yes, you can.
universal
Here's
health
how
care
we do
without
it.
raising taxes?
Yes, this is how we do it. Number one, my plan is mandatory. You do have everybody sharing, the employer, the employee, you have the state and the federal government. Secondly, I believe that we can have a plan where if you are satisfied with your health care plan, you can keep it. No new bureaucracies. But in addition to that, you focus on prevention. You allow everybody to get the congressional plan that every member here has. You bring Medicare 55 and over. That's what you do.
Thank you, Governor. I promised Senator Dodd he could weigh in as well.
Well, listen, there's not a person in this audience or who's watching this program who wouldn't tell you that they've encountered the problems of the healthcare system in this country. It is shameful. We rank 42nd in infant mortality in the United States worldwide. We rank 45th in life expectancy. It is shameful that in the 21st century, we have 47 million of our fellow citizens without health care coverage. 9 million children, and the number's growing every single day. Look, as we've said here, there's basic agreement about universality here, dealing with information technology, preventive care, chronic illnesses. What's been missing in all of this is the ability to bring people together to get the job done. That's what I've done for 26 years. That's what you need to be able to do if you're going to get this. No one party is going to write this whole thing. It's going to take cooperation to get it done.
I'm going to move on to the next question.
Can I say just 15 seconds?
I'll let Senator Edwards, and then I'll let Congressman Kucinich. I got a specific question for Congressman Kucinich, but go ahead.
Okay, I'll be very quick. I think it is very important, though, to understand. I think Senator Obama was very honest just now. We have a threshold question about whether we're going to have truly universal care. The New Republic has estimated that his plan will leave about 15 million people uncovered. He says he will do something about that later. I believe unless we have a law requiring that every man, woman, and child in America be covered, we're going to have millions of people who aren't covered. Secondly, all the savings that Senator Clinton just talked about are in my plan and they're in Senator Obama's plan. And both of us have recognized that it's going to cost significant money, and we've talked about how we're going to pay for it.
Senator Obama.
Well, since John referred to me, I agree with him on the second point, which is we've got these savings and we're still going to have to do a little bit more, partly because you've got to invest up front in, for example, information technology so that rural hospitals that don't have computers are able to buy them, and they're going to need some help. But on this issue of mandatory versus non-mandatory, not going around trying to avoid buying health care coverage. And in fact, if you look at auto insurance, in California, there's mandatory auto insurance. 25% of the folks don't have it. The reason is because they can't afford it. So John and I, we're not that different in this sense, that I'm committed to starting the process. Everybody who wants it can buy it, and it's affordable. If we have some gaps remaining, we will work on that. You take it from the opposite direction, but you're still going to have some folks who aren't insured under your plan, John, because some of them will simply not be able to afford to buy the coverage that they are offering.
Children cannot make that decision.
Well, and that's why I've got mandatory.
The decision he's talking about people making cannot be made by children, and that's why you have to require that they be covered.
John, I've got mandatory insurance for children.
Just 30 seconds.
For that, exactly that reason.
Hold on one second. I promise Congressman Kucinich. Go ahead.
I reject this whole approach, and the American people should know that with half the bankruptcies in the country connected to people not being able to pay their doctor bills or hospital bills, premiums, co-pays, and deductibles going so far through the roof, 46 million Americans, no health care, another 50 million underinsured, there is only one way to get health care coverage for all Americans, and that is to have a universal, single-payer, not-for-profit health care system, Medicare for all. Wolf, I've written the bill. It's H.R. 676 with John Conyers, supported by 14,000 physicians. And you know what? What Senator Clinton, Senator Edwards, Senator Obama are talking about? They're talking about letting the insurance companies stay in charge. They're talking about continuing a for-profit health care system. And I think we need a president who's ready.